Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and I'm very excited to be here today with Casey Hein. Thank you, Casey, for joining me.
Thank you for inviting me, Vanessa.
Oh, of course. Now, I know Casey, but for those of you who don't know Casey and the impact that she's had in our industry, I thought I'd just tell you a little about her. Casey is a visionary behind the real-life application of periodontal research, and she's also a pioneer in building dental medical collaboration. I've known Casey for probably several years now, and done some work together, and I know the passion you have for this area of periodontal systemic links. I know that you have multiple courses. I think you have 7 courses listed with us right now in this area, and I would say that all of them are meaty. They have deep content and super timely and important. For the purpose of this course, I was hoping you could give us kind of an overview for the event planner who's tuning in and wondering, well, where might Casey be a fit on our program? So could you give us an idea of what do you speak about? That would be the first question. It's like, roughly, what do you speak about? What areas?
All things periodontal systemic. Not all things, but some of the things I talk about. I'll tell you the biggest demand right now is in the area of diabetes, obesity, looking at the threat of periodontal disease during pregnancy, preventive cardiology, the whole cardiovascular disease, periodontal disease link, and medical dental collaboration in this area. Another really often requested courses and why it's so important to do early diagnosis of periodontal disease now. And so I think that, or periodontal systemic evidence has been increasingly strong over the last 20 years. And what's really exciting is we used to just believe that it was coming out just in dental literature. But the reality of it is it's come out in a lot of the medical literature now, and some of the most prestigious medical journals in the world. New England Journal of Medicine, et cetera, et cetera, et cetera. So here's what's happening. Physicians and nurses are actually reading this stuff. They're getting it. And what we need to be doing is moving ahead with beyond just reading about it and thinking about it to actually implementing it into our practices on an everyday patient experience, and then connecting those dots and connecting that to build medical dental collaboration. And how do you do that? So yes, everybody's heard about periodontal systemic links. That's not particularly new and sexy, but incorporating it into patient care and bridging that schism that has happened between medicine and dentistry. How do we do that? I think is really, really important. And I think that I have a lot of good experience in that area.
Yes, you do. And so what I'm hearing you say then is that in each of these courses, it's really about helping them connect those dots, helping those dental professionals who would like to be able to do more in this area and are just not quite sure how to bring it all into practice, the protocols, the communication, that sort of thing. Can you give us a little flavor for what is a typical course like? How do you help them connect those dots?
So I think it's really important to understand the science. So what I try to do is highlight the very first science that came out on these various areas. Like in 1989, Mattel and his colleagues were the first to report a relationship between myocardial infarction and periodontal disease. So, and that's kind of what opened Pandora's box in all this. I think it's important to explain the science so everybody gets it. And I don't mean dumbing down the science or the biological pathways that are implicated here. I think it's important to understand them, though. Mm-hmm. And that includes people who are at the front desk. So I think these courses are all great for teams to come. And the other thing that's significant about some of these courses, the courses that I give, is there's always going to be case-based learning. And hands-on participation, for instance, when we start talking about obesity and how we begin those conversations, those difficult conversations with our patients, practicing on each other and cases. How would you take care of this? And I really do try to get distributed these cases before the courses begin. And that gives people an opportunity to think about it even before they come. And in many instances, we continue that dialogue even after the courses are over. And the other thing that I want to just mention here, Vanessa, is that everything I talk about, every recommendation I make, there are actually assets on my website. For instance, templates from a dentist to a physician talking about a patient that they're concerned about, a patient that they're concerned may have diabetes, or a patient who is a known diabetic that might need to be treated for periodontal disease, et cetera, et cetera. So there's all sorts of assets that exist on my website for free for people to be able to use to implement the things that we talk about in the courses.
I love that. That's a real value add. And I also love that you are able to put in so much interaction, but also working together as a team, with each of your courses.
That's so important.
Yeah. And so we have multiple courses to choose from. So is it truly like, always think of the speaker's packet as like a menu at the restaurant, like trying to decide what we want to eat.
Yep.
So if for the meeting planner who sees, several different topic areas, is there some flexibility that they can kind of mix and match and create their own?
Absolutely. Absolutely. And most of these programs, I can customize any of these to fill specific spots, but most of them, the way they're designed originally is for a 2 or 3 hour segment. Many of the meetings that I've spoken to, the major meetings, we actually do back-to-back days, so that we might be talking about diabetes and obesity, diabetes in the morning, obesity in the afternoon, one day, and cardiology and pregnancy the next day. So it's and it's a very rich format. It's a very rich format. And this body of science we call periodontal systemic medicine, and implementing it into valid evidence-based ways is actually, I think, the most exciting opportunity we have as oral health care providers to redefine ourselves, I should say, in the healing arts. And it's a great practice builder. Patients, research suggests, and this has been researched, they love it. They love when you ask about their HbA1c levels, or they ask you, you ask them about their most recent visit with their cardiologist. We also know that physicians embrace this. They love the fact that dentists and dental hygienists are really looking beyond the tonsils and connecting, reaching out with them. And increasingly, physician communities are on board and really open to developing these collaborative relationships. I'd like to help dental providers, oral healthcare providers, learn how to make that connection.
It is a very exciting area, an exciting time. And a perfect time to have these type of programs on one's agenda for our different meetings around the country. So before we wrap this up, I have one more question for you.
Mm-hmm.
Is there a one-line bottom line? Is there something that we haven't discussed already that you'd like to leave the event planner with, that you feel would be important overall around your topic area? One thing that you'd like to leave them with?
And I think just understanding periodontal systemic science is not enough. Increasingly, we are going to be called on to reconnect the mouth to the rest of the body. And I think we're at a time now where it's going to be required. And we can't default. We can't say, we can't not be involved in this. I think it's going to be a requirement. If you look at just one of many trends, just the recent edition of the procedural code for chairside testing of HbA1c that the American Dental Association just came out with. That's exciting. There's going to be more point of care testing, chairside testing for different genetic things. I mean, genetic predispositions for things, and understanding how, these inflammatory biomarkers that we're testing for, and the microbial markers, and what we do with this information. It's super important, and that is going on now, and it is our future. So it's exciting.
It is. And Casey, thank you for being a leader in this very important field.
Thank you for saying that.
I know that for many years this has been a passion for you, and you were an early adopter of understanding the importance, and have really led the way for many years. And thank you for that, because it really is visionary, and you definitely are an expert in this area. I think the meeting planner can't go wrong in bringing you in for a course in your body of courses. So really, you're welcome. And I'm honored that you are here today with us today. Thank you for creating this little video for the event planner to learn more about your courses. Each of those are detailed, by the way, on the dentalspeakerbureau.com website. You just go to find a speaker, look up Casey Hein, H-E-I-N. You'll find Casey listed there. Her contact information is all available there. If you'd like to reach out to me, info@dentalspeakersbureau.com. I'd be happy to connect you. I think I'm really excited about the future, especially with leaders such as yourself out there on the forefront sharing. The future's bright in dental meetings.
It's exciting,
and dental
for sure.
care.
Yeah. Thank you again, Vanessa.
Thank you. And until next time, be well all.